Hi everyone, Dr. Mike Ferguson here. I want to introduce you to our quick reference guide for helping those in acute suicide crisis, and I want to do that tonight in a kind of a unique way, and that is to go through a case study of a gentleman who is having a acute suicidal crisis, and to show you how we actually worked with this man and moved him away from suicidal crisis by using the quick reference guide. Now, it is my passion and has been my passion for a long time to equip the ordinary folk, the non-professional person, to know how to help someone who is in a acute suicidal crisis, or even someone who might even just be thinking about suicide. So what you have in front of you here is the quick reference guide. We do have that in our store for $15, and it is a 35-page ebook that will give you details that I'll be showing you here in just a few minutes. So let me go ahead and go over to the case study. If you've noticed, I've redacted the information that is from this transcript so that you'll not know who it is that we are talking about. Names have been removed. The only name you see is mine. I am the counselor from the text counseling text line that night. And so I just want to show you a little bit about how this conversation went and where we actually learned the material from, and from the quick reference guide, so that you'll see how effective it is when you are ready to use that. So I want to unwrap that conversation for you. What we're looking at is a 33-year-old male who texts the crisis line, and he was in very much acute suicidal crisis. So as we go down through here, one of the things I want you to notice is here he had a friend of his that suggested the number, and so we're very glad for that. We want to encourage you to give the teen text crisis line number to anybody. And if you notice, this is a 33-year-old man, and he is not a teen, but he needed help. So the text crisis line is really for anybody. And so somebody gave him that number, and I would encourage you to also give that number. It's 855-449-1212, and you'll find information about that at drmikeferguson.com, as well as in the the quick reference guide for those in acute suicidal crisis. And so as we begin, you'll notice he's starting to talk about having a hard time. And then I ask him here, what is he having a hard time about? So we encourage you, and we show you to have some open-ended questions as you begin. And obviously, if you go down through here, you'll notice that the precipitating event, which is always found in a suicidal crisis, for him was a recent divorce from his wife of 12 years. He was diagnosed with bipolar, and he actually wants his wife back. And so he says he's contemplated suicide on a daily basis. So this is something that's acute and very much chronic. And here I want to point out just the fact that at this point I am at a deeper level of listening, and I just want him to know that I understand what it is that, or at least I want to validate his feelings that, people who go through this kind of issue are going to feel that way. And so I go on to say to him, I can only imagine how that feels. I never say to somebody that I know how you feel, because I really don't. Even though there may be similar circumstances, the reality is I can't really know what somebody is feeling. So as we go down through the conversation, I ask his name. We talk about the fact that, how long ago was the divorce, so there were some clarifying questions. And as you notice, he says tonight was the last straw. And we can talk more about suicide and the process of suicide. But here again is an open-ended question of clarity. What happened tonight? What took place? Give me the facts of what's going on. And as we work through the conversation, he begins to talk about his ex-wife being the very reason he lives for her. And if you'll notice, I say here in this conversation, there are a lot of people who thinking about killing themselves when they go through the pain of what you're facing. And so I went on to ask him the very completed question of, are you wanting to complete suicide? And so one of the things that you'll find as we go down through here in the conversation, let me bring up the page where you'll find that information here in the reference guide. So here's how you assess for suicide ideation and plans, and this is where you begin to form the questions, like I did with this gentleman about, are you thinking about suicide? Now the issue with this particular gentleman, he's already said that he's thinking about it, but I wanted to confirm with him, and that's what this conversation is right here. And so I say to him at this point, so you said you think about suicide every day. Do you have a plan of how you will kill yourself? And so as we go down through here to determine assessing for someone who is just having suicidal thoughts, or if they are having lethality of suicide, you'll notice the questions here that you ask someone who said, yes, I want to die by suicide. And so the quick reference guide basically gives you very specific answers. If someone says no, if we go back here, if someone says no, then we understand that they're thinking about suicide, but they're not quite that lethal. But if you go down through here, you see a specific plan, you see lethality, you see the availability of means, and also the proximity. How close is there any help for this particular man? And if you notice at the bottom of page 19 here of the quick reference guide, you will see the questions that are asked after he says, yes, I am thinking about suicide. So here's where I began to talk about, okay, what would you do to kill yourself? So he does have a plan, and so I want to find out what that is. He talks about an overdose on prescription drugs, and he tells me about the fact that he has those nearby, and he's very depressed and has no one to talk to. And so my next question, as is stated here in the quick reference guide, is, have you ever tried to kill yourself before? And there's a reason for that, because the risk of someone lethally killing themselves goes up much higher when there is a past suicide. So that's my question, and I learned that again from this particular quick reference guide that I have right in front of me. And so he said yes a few times, and he does go on to say just in the past year. So as we begin to go down through this discussion, I'm still asking about his plan. How did you try to kill yourself during those past suicides? And of course he mentions that he tried to overdose, and that was his first choice of suicide normally for him, and so he's going to refer back to that in this second attempt. And then he talks about self-mutilation. And so I asked him about how old he is. We talk about a birthday coming up. And then I asked him, has there been any other family members who have completed suicide recently? Now, the reason that is because here in our quick reference guide, you will be instructed about asking that same question. Do you know anyone who has completed suicide? And have you had these thoughts before? Have you tried before? And so basically the quick reference guide for helping those in acute suicide is really helping direct me on how to help this young man, 33-year-old man. And he does talk about the fact that he has family members that have completed suicide before, and he's gone through that. And so it sounds like the divorce. I go through some of what's going on with the divorce, and if you notice right here, the lethality of his suicide crisis goes up, because as he says here at this particular part of the text, that he's sitting there with a quart of liquid plumber. And so I began to talk about does he live alone, and begin to see if he's there by himself, if there's somebody else with him. And he tells me a little bit more about his life and what's going on, and all the things that are happening. And of course, what happens here with our quick reference guide is that we want to talk now about suicide proof in his home, as well as getting to developing a safety plan. That's where we're at with this man. So he has a precipitating crisis. He has attempted before. He's had family members who have died by suicide. He's sitting in his home alone with the means in which to complete suicide. And so at this point, we are now moving to the idea of developing a safety plan. So that's where we really are at this point. And so he goes on down through this particular script. And so I talked to him about, have you mentioned the bottle of liquid plumber? So he mentions that, and the first thing that we want to do in an acute suicidal case, as you are instructed in the quick reference guide, is to have that means of suicide put away. So first, you mentioned that you have a bottle of liquid plumber. As we talk, would you mind taking that, putting that in the cabinet until we finish talking? Now, I'll come back to the reason why I said not to flush it down the drain or to throw it down the drain, but I'll tell you about that in just a few moments. And then I say, let me know when you've done that. And so here's my question about, again, we're in safety planning, and have you put the liquid plumber away? And he has said yes. And so here is not necessarily what's wrong with him. We want to talk about what's happening with him, and we really want to begin to focus on the idea of being very solution focused, and this idea here, it's not what's wrong with you, but it's happened. And so now let's kind of get our lives back together. So as we go down through here, you'll find at 10:27 p.m., again, I am reflecting back to him. I'm showing him and validating his feelings, and it's got to be a very painful thing, and that's got to be very hard. It creates a lot of hopelessness. And then if you notice, he was going to leave the conversation, and then I went ahead and pressed, do you have just a few more minutes? And I talked to him about needing to talk to him. And so he says, well, what do you want to talk about? And this is where we begin to talk about safety planning. And so this is where this is. I want to talk to you about being safe tonight. And so what do you think? And so basically, as we get back to our reference guide, one of the things that we want to do is we want to develop an agreement with him. So here's some of the basic safety plan that's included in the quick reference guide. And then this is where we talk about having someone agree with us. Research has shown us in suicidology that someone who promises to stay alive for a certain amount of time will keep that promise. And that's been a very effective way of helping people to stay safe. In this case, if you notice on the quick reference guide, I said 24 hours. But knowing that this young man was very much in an acute suicidal crisis, I mentioned just 12 hours. And it's got to be kept very short. And so I asked him, what do you think? And of course, he misunderstands and thinks we got to talk for 12 hours. And that's not what I said at all. But more so that you will not do anything to kill yourself over the next 12 hours. And so we kind of collaborate on that. And that's what that agreement, as you notice here, but it also is something that we want to be proactive about. So we begin to talk a little bit more, about the 12-hour time frame. It was something that he was able to do because he promised that he would be able to do it. But here's where I want to show you the plan B. And again, the quick reference guide for those in acute suicidal crisis. Here's the contingency plan. I want to be proactive. So if you feel that you can't act on your plan of being here with us for 12 hours, what should you do next? And that's our plan B, the contingency plan, which you'll notice I have that right here. And so I give him these reference numbers, and I give him the text line number, of course, and this is the 24/7 suicide lifeline number. And so again, the acute reference guide is, or the quick reference guide is giving me everything that I need to know to really know how to help this person. As you notice, it tells me the specific words to say. I don't have to try to come up and dream with these things. So that's why I think this is such an important tool for everybody who has someone in their family or someone that is reaching out, youth servicing professionals, pastors, youth pastors, friends, managers, co-workers, whatever. This is an amazing investment, $15 investment, to get this acute suicidal crisis quick reference guide, because it will tell you everything that you need to say. And so as we continue this conversation, you'll notice that one of the things that I do at 10:40 is I just kind of recap with him. Okay, for the next 12 hours, you promise not to kill yourself. But what can you do during the 12 hours if you have a fall? And he goes on through and talks about the plan B, and we move on down through there, and we talk about that he does promise. And at 10:43, I talk about follow-up. And this is very, very important as we talk about that with the quick reference guide as we go down through here. Here is a sample of a safety plan. If you don't feel comfortable knowing exactly what to say, you have the 6 steps basically that can walk you through those issues. And of course, we go on and talk about the misunderstandings of suicide. But let's go back to the case study transcript, and you'll notice that as I'm going down through here, I give him, the plan B, because our teen text crisis line is only there from 3 p.m. to midnight, 7 days a week. And so I have one final question, and that is, can I pray with him? And I wanted to understand a little bit more about his work schedule to see about his availability. And so I pray with him, and we get down through there, and he says, "Thank you, I'll keep my promise." And sure enough, he does keep his promise. In fact, I heard from his cousin after I talked to him a couple of days that he is doing well. And this has been about 2 weeks later, and I just got a Facebook private message from a cousin that says that he is improved, he's not suicidal, and he has gotten through that acute suicidal crisis. So it's hard as someone who's a psychologist and a suicidologist and have an agenda that wants to keep people alive, with 42,000 people who kill themselves every year because of psych ache and pain. To me, it's very important that this quick reference guide get in the hands of every person that needs it. A loved one could call you in the middle of the night, and this could be in your drawer by your bedstand. It could be somewhere in your home. You grab it out, and it just begins to show you all of the different things that are related to there. Here's a table of contents. I go down through and talk about all of the reasons why this was even born, and then the outline of the book, and we go through the warning signs. We talk about how to assess for suicide ideation and plans. As you notice here's the level of suicide risk, how risky they are, so you'll know exactly where they're at. What questions do you ask someone in a suicidal crisis? And of course, as we've talked about, here are the 4 areas that we want to assess, the questions to ask if they do say yes, and these are some things not to say to somebody, so you'll be confident that you won't say the wrong thing. If you encounter somebody in a public place, we've got that there. Then we talk about suicide proofing your home, and this is really very important for moms and dads, parents, grandparents, people who need to keep their home safe during a suicidal crisis of a teen or even a spouse. And so here is the exact direction about what to do in order to ensure your home is suicide safe. And then we talk about the safety plan, which I talked about with you. And then we talk about the misunderstandings, the misconceptions, the myths of suicide. And probably one of the biggest myths is the idea that if we ask somebody to, if they're suicidal, that they will actually put the thought in their mind and that they will inevitably do it. And that is not at all correct. That's kept us away from asking a lot of people. Chapter 6 of this quick reference guide gives you a lot of smartphone apps. So if you don't have your quick reference guide with you, you can look for that app on your phone. Here's the depression screening tool that you can use to assess yourself as well as anybody else. They basically take you through a group of questions and then give you a score at the very end. I use that every day. And then this is something that, to me, if you have a loved one or a family member or a friend who is in suicidal crisis, this mood monitoring app, which you'll find at mood247.com, will help you to do that. It sends a text to the person in crisis. They do a scaling question 1 to 10, and then as they fill out this membership site, they can include you as a person who also gets their mood, so you can kind of keep up with the ups and downs of what they're going through. I've included a bonus book for you in this quick reference guide, and you can download that there. And then here is the poster or flyer for the Teen Text Crisis Line, which are basically staffed by fully devoted followers of Christ. And then if you want more information about suicide and all the things that are related to it, we have a rich history of suicide research, and we are part of a large movement in suicidology that's done by the American Association of Suicidology. So I just wanted to introduce you to this incredible manual. I would love for every person to have one in their hand, and you can get yours from drmikeferguson.com. Click on the store, and in that store you'll find the first guide that's there is the quick reference guide. And so I just wanted to show you what's available to you You literally can be someone who stands between a person and taking their life by suicide. So I hope you'll check it out. I hope you'll get one and have one ready for you because it will help you to save a life. Thanks for being a part of this quick video session, and we will pray that God uses you to save a life.